lot of the people that come to me have some pain or they just want to be more functional, and that's my goal. Work with them and get them to their max. I want them to enjoy time with their family. I want them to go out and play sports if they want to, and the ability to touch people in that way and open their eyes to a different possibility, and certainly a life without pain or less pain if possible.
All right, welcome to Daily Dose with Dr. Moshe. Great insight, great medical advice, great tips. My name is Big Al Sams. I've been doing radio and TV hosting and producing for nearly 20 years. I'm staying curious all the time. And here's my round table here we got Miss Rachel Robillard.
Hey y'all, I'm Rachel. I am from Texas, living in I'm from Texas, went to school in Austin, from Dallas, living in Los Angeles, and I'm a host and producer. All
right. And we also have the one, the only, Dr. Moshe Lewis.
Sure. Happy to see everybody today. I'm a physician, like Big Al said, and I'm practicing in the Bay Area every day of the week, sometimes Saturday. Don't tell anybody that. And I see patients, and certainly I'm loving it. Happy to be here, Al.
All right. Secret safe with me, by the way, Dr. Moshe. So we'll keep that on the low. But first off, let's start with the big subjects going on right now, air travel. That is really affecting me because my dad lives in Texas with my mom, and he had to fly out to California, to LA, to handle some family business. And he was very nervous, and he was, we tried to get the mask for him and everything. He was very, very worried about, the passengers on the flight is going to be like when he gets on the plane, because obviously he hadn't flown in a while. And we have somebody that can probably answer this question, right, Dr. Moshe?
Yeah, we're excited. We have not only a pilot, but a Marine veteran. And he had an intense story. Maybe we'll get a chance to tell us, John Rufo, where he had to actually ditch a plane. And so we're excited to have John Rufo with us, Marine veteran, and also flying for the commercial airlines more than 20 years now. John, welcome.
Hi.
Hello, nice to meet you.
Nice to meet you too.
Pleasure to meet you. Hey, by the way, first off, we just want to get out the way. Thank you for your service right out the gate.
Thank you very much. It was my pleasure, actually.
As a pilot, is it safe for people to be flying during this time?
I think so. If you go to Delta's website, anyone can see this. They'll go over what procedures they're taking. They use these electrostatic machines. They spray the airplanes down through the entire cabin with these with a smoke type thing that decontaminates. Masks are required by everyone at all times as far as crew members and passengers. And they've also distanced the seating. You can't sit next to someone. So if it's a family member, yes. Otherwise, they're running about, I want to say 40% capacity, and that's it. They'll shut it off at that. So, but the airports are ghost towns, and not that many people are flying. So the 40%'s not mattering anyway.
And some people also have questions about sort of the pre-process. So we talked a little bit about the fact that people are wearing masks. Are they thinking that they need to do temperature screenings and ask them questions, and that you might potentially show up to the airport and I'm sorry, I'm interrupting you. But when you show up, I believe the TSA asks questions. I can't recall who does. They leave the crew members alone in these matters, but I believe you have to sign a form saying that you haven't been sick in a certain amount of time. I don't know about the temperature. They were not, the last time I flew, they were not taking temperatures, but it seems they're still getting more and more serious, but everyone has to have a mask on and sign this form. I'm not quite sure about the temperatures.
Very interesting. You mentioned about the mask. There's some passengers who just ignore the whole ruling of wearing the mask. They think it's recommended and not required. And so now United Airlines has taken the leap of saying, hey, look, we're going to create a no-fly list. If you don't wear the mask, is enforcement the next step in all the airlines to make this thing happen for people's safety?
I'm not too privy on the thinking behind that, Alan. That would be a matter of, I would look at it as a crew member that kind of like someone who's drinking too much or someone who's harassing another passenger or something like this. I think we would, at this point, our thinking would be to treat them in that manner, that this person is being uncooperative. Hopefully those are the kind of people you find before the flight takes off, so you can go back to the gate and get rid of them, because they're not going to, if they won't cooperate, it makes things very, very difficult.
Enforcement is not necessarily the call of the day, at least right now. Pretty much everybody's kind of going along with the whole wearing the mask and safe for themselves, right?
Right. And all passengers are like that on all matters. Most of the time, 99.9% are like that. And there's always the few outliers who, I'm not going to wear a mask, or, I'm going to drink from my own bottle, or whatever they want to do if somebody wants to be a problem. But I think everyone is on board enough to where, there's not going to be a problem with that.
Oh. So what other things have you been doing as a pilot to take precautions? Are you wearing a mask in the plane as well?
The crews are required from the time we walk into the airport to have a mask on.
Okay.
We go down to the pilot's lounge. Of course, there's no one down there anymore. It used to be a huge free-for-all with people all over the place, but there's only a few people down there. You have to have a mask on. You have to have a mask to walk onto the airplane or be in front of the passengers. It's really difficult to sit and fly an airplane and talk on radios and such. The mask disappears in the cockpit.
Okay.
I don't think but I'd have to honor if I had a crew member that was very, very concerned about it, or maybe had small children or older adults at home that they're worried about it. I would wear the mask the whole time, but there's some distance in there. And just as a side note, they don't tell passengers this, but the cockpit is actually over pressurized so that the air will go out of that cockpit if there's some sort of problem, but it won't come in from the passenger.
Okay.
Interesting.
Okay. Yeah. And so I understand the borders were shut down for international travel when the start of the coronavirus was going on. I remember Trump saying no international travel, but as you said, international travel is picking back up. And so the difference between domestic travel and international travel, regardless of, I guess like the biggest difference is the amount of time spent in the plane. But is there a big, you educate me, is there a big difference, especially with this coronavirus, international travel versus domestic?
As far as the treatment and the precautions, they're about the same. And as I said, those airplanes are basically empty. There's hardly any people. So everyone is wearing their mask, following the precautions. Most of the countries are using the same precautions. However, there's the only places that I fly to out of New York on a major airline is Amsterdam and Paris. That is it. And so we don't go to these destinations like the smaller ones, like say Nice or Lyon or even Rome for that matter.
Well, I asked specifically because my sister's about to go to start MBA school at the University of Texas in Dallas. And she's like, Rachel, let's do a trip before my MBA starts. So she actually wants to go to Mexico, like in July. And I'm like, honey, there is a global pandemic happening. I never thought I was going to be traveling in 2020. What are you doing? What are you thinking? And Jackie, my little sister, is like, come on, Rachel. Like, as you said, Mr. John, not many people are traveling. So this is the best time to travel because not many people are traveling. But my anxiety levels are just through the roof because I wasn't expecting to be traveling in 2020, let alone international travel. So that's my question for you is like, I can see myself going back. I'm currently in Texas right now. I can see myself going back to LA. Okay. But the fact of traveling internationally during this time, specifically to Mexico, I can't help but get very nervous. And so I'm just a little scared. What would you say to me? What's your advice?
Well, I'm trying to not say you're on your own, Rachel. If you're asking about the airline end of things, the safest place you can be in this whole evolution that you're going through here is on the airplane. Everything's been sanitized and wiped down and gassed, and the air is constantly filtered, and everyone has a mask on, and everyone's been screened coming on. So you'll be fine on the airplane. Now, I can't speak for what the status of COVID-19 is in Mexico or actually anywhere else for that matter. I say for myself, now I'm starting to crank it up again. And so next month I'll be having 3 trips to Amsterdam, one of which, by the way, will be my final flight to Amsterdam. And I understand that they've pretty much opened up everything, restaurants, indoor, outdoor, and all that sort of thing. So because they feel that they're on the decline and will remain so. But, you have to look at the individual location like Mexico. That could be raging there. I'm not quite sure what's going on.
I just wanted to chime in that we talked about New Zealand last week, and so they just had 2 cases which were related to people traveling. We won't say where they traveled in from, but they immediately quarantined them, and that's 2 weeks that you're shut down. So a lot of the people that might come to these various countries may not be able to spend time at the country. And so New Zealand started to ban some of the flights again and immediately quarantined the 2 people that had arrived because they had no cases for almost a month. And that just happened yesterday. So you're right, Mr. Rufo, it is so easy to have a change on the international side that we may not be aware of. But thanks so much for giving us time today. This has been excellent.
Oh, it was my pleasure. I could talk all day. All pilots can.
Yeah, there you go. Captain John Rufo, 21,000 hours in the air as an international pilot, saying, hey, airplanes are safe. They're doing their best. Thank you so much for your time.
You're very welcome, Alan. It was a pleasure.
This is kind of a weird one. So there's in England, there's a no sex law. We're going to try to switch gears a little bit and have a little true or false, fact or fiction. We've taken some rumors and some things that's happening, and we just want to ask Dr. Moshe whether it's the truth in the booth or not. So we just want to find out. So Dr. Moshe, just go ahead and get ready here. So first off, we're going to talk about disinfecting your groceries, going to the store and bringing the groceries home, the potato chips, the fruit, and then you wipe them down. You wipe down the bags and the cans, and obviously you rinse out the fruit and vegetables. You've always been taught that, but is that overkill? Is that the right thing? Is it fact or is it fiction?
All right, and I'm going to punt to Rachel. What do you think?
Well, I personally don't disinfect my groceries. I've heard of crazy stories of people disinfecting and also disinfecting their Amazon purchases and just putting their mask on while bringing in their Amazon purchases. And I think, to each their own. I personally don't do that. I don't think it's necessary. I don't think so, but you tell us.
Exactly. And we're going to say you are right. It's not necessary. It is a little bit over, but plenty of people are doing it. And the experts kind of give you both. They sort of say if you've got fruits and meats and things like that, small things that have no major skin on them, like grapes, you should wash them. And that's something, again, that Grandma always said, and I think she gives really good advice. But in terms of really going through an intense process to disinfect every single thing that's coming into your house, is that absolutely necessary? No. And in fact, at least as relates to the grocery store, it's more important that we keep the social distancing, which we're sort of starting to see erode. But that's where the greater risk lies, running into people that may have something, as opposed to worrying about the various items that you get delivered to your door. If you want to, go ahead, but it's not necessary.
Okay, well, hey, it's all good to clean off a little bit, but don't overkill it. That's basically what you're saying. So, hey, that's good. So, second of all, this is kind of a weird one. So, there's in England, there's a no sex law that was probably instituted to stop the spread of COVID-19. At the time, all the information wasn't there at the time. We're a little bit more knowledgeable now, but the no sex law said you can't have sex even with someone in your own home. If you're married or if you have separate households, don't touch nobody, basically. There was a similar law, a similar ruling that happened in New York City. Not that extreme, but I don't know if that's even, is that having.
How would you know? How would
is
you
that
know?
A thing?
Yeah,
What?
and I just don't, unless you admit to it.
Exactly.
What?
So I'm going to say that it's fiction. I'm willing to be wrong on this one, but in terms of enforcing it, I think it's impossible. It's not a mandatory report. So I'm going to say it's fiction.
Okay, we'll just go with that. I don't know if that's going to stop spreading COVID. It'll stop the spread of other things, the no sex law, but COVID, not so much. I don't think so. That's my opinion. We got to move on a little bit here. So I got my mask here. I had when I came into the studio, and everybody's everybody's trying to be safe. Everybody's trying to look good, and we figured that's gonna be a part of reality. So everybody's trying to be fashionable and get with the pendant and all the other stuff on the mask. But we don't know, will these masks work? What masks work? What mask doesn't work? Oh, and Rachel, you're looking fabulous, girl. Fabulous.
You're right. I mean, there are so many different kinds, and people obviously are making various types of statements with them. And the bottom line is that almost anything works. We like if it's got a couple of layers, something to kind of keep the stains off that might be get onto the front, and then some type of a filter. But the big ones, the 95s, the N95s that sort of kind of look like this, those are probably best reserved for the healthcare workers and a bit over. We just are trying to really encourage people to wear them, especially when they're out in a setting where they're around a lot of people. We were talking earlier, we're starting to see that kind of erode, and people have gotten tired. It's getting hot. People sweat. They're really sort of feeling like, I don't really need it. It's the summer. I'll be fine. Are you noticing that, Rachel, where you are?
Yeah, it is so hot in Texas. So wearing a mask it's hard for my breathing at times. And so I've seen a lot of people not wearing masks specifically because of that, which is unfortunate because I know it's a huge safety requirement at some places. And I will be honest, I've gone to some restaurants and some places just to go out, and some are wearing masks and some are not. Some places enforce the mask and some places do not. It really just depends on where you go. But I want to talk about, Al, like what's the difference between the masks? I don't have that little filter situation. So is that something I need to invest in?
So that's a good point. It sounds like Al's on mute because he can't talk to that thing. And that's a whole nother piece too that we're hearing people complain about. But it's true, the mask kind of really, is protecting others, is keeping your germs in and things of that nature. And there's a concern that if it has a valve, the air could potentially get out if you were coughing and things of that nature. A lot of healthcare workers have a shield and a whole process in addition to the mask to obviously keep themselves safe, because we certainly need our healthcare workers to be safe. So bottom line is that it's definitely not necessary. And many of those people, I think in terms of affordability, are finding the surgical masks or even simple ones that they may have made at home. Hopefully though, at least maybe with a filter, at least a couple of layers. 3 are recommended, but at least if you've got a couple of layers, you're good to go. So it's looking serious, Al. You got it going on there, but certainly may not be absolutely necessary. I was out on the trains and things like that, and people were socially distancing. But even here, when I went to the stores, just like Rachel was saying, a lot of people aren't wearing masks or not socially distancing, and you've really got to do both together for it to work. But go ahead, Al.
No, you're good. So basically what you're saying is the surgical mask, the N95 mask, is the one. But if you can't find one like that, then at least get something with at least 3 layers of covering. Is that what you're saying?
Right. So the surgical ones are just the easy, they're sort of everywhere. I've seen them in the corner store and things of that nature. They're blue with the little wrap bands behind them and things of that nature. So they're very, very easy to find everywhere. And they're the most inexpensive. The N95s, we'll put those off to the side, leave them for the healthcare workers. It's a question that came up several times this weekend. How do I look at my risk for going out and getting COVID?
Listen, we have, man, this is pretty cool. So we have Moshe's Minute. We're going to come up right now. And you have a very important thing you want to talk about really quick, right?
Sure, and we will keep it to a minute, if not less. And it's a question that came up several times this weekend. How do I look at my risk for going out and getting COVID? Because people want to go out, they need to get out, and we totally understand it. So we think that people have to really sort of look at their own medical profile, maybe even check in with their doctor. Is their asthma under control? Is their diabetes under control? Is their high blood pressure under control? And even realizing that in many cases it may and sometimes not, kind of work with your doctor to make sure that you really, especially over the summer before we head into the fall and the winter time, maybe a little bit harder to get out to the doctor, get those numbers tight. So that would be number 1. Get in touch with your doctor, make that annual visit appointment and see if you can get your numbers right. Then 2, in terms of going out, keeping it really simple, try to maintain that distance. That really is one of the most important things. And if you wear the mask, you really are safe. And then number 3 would just be, think about the time. If you are out for good periods of time in a store or the mall or things of that nature, you really want to, come home, make sure you wash your hands, maybe carry hand sanitizer with you. And on the other side, if you can minimize that time, don't stay in the store any longer than necessary. Make a list. Don't stay someplace where there's a lot of people any more than absolutely necessary. So those are the key tips, and we hope that people will, really think about assessing your own risk and saying, hey, I've got to look after me, because somebody may not know. They may look at me and think I'm totally healthy, but I know what I have going on, and I checked in with my doctor to make sure I stay as healthy as I can.
When I had my allergies and my allergies were just going crazy, I was like, is this COVID? Yes, as you said, to make the regular doctor appointments. And that's what I've been doing. I've been sticking to my annual appointments. I actually went to my dermatologist appointment because, speaking of masks, I've been wearing my mask all the time. And I've noticed a lot of breakouts along my jawline where I typically wear my mask. Is my mask to blame for these breakouts? And my doctor, my dermatologist, actually kind of gave me the answer I was not looking for, and it was like, no, the face masks are not causing your breakouts. And I'm like, what? And it's actually more hormonal, which I'm like, okay, all right.
Well, this is a good point that you bring out, because certainly it's a question that comes up a lot. Is it an allergy? Is it a contact dermatitis? And you all may know, but I'm from New York, and that's where my brother-in-law is in practice. He's just been named top U.S. doctor. Dr. David Wertheim is here with us today. I was surprised, but we were able to get him just literally off the cuff. And he's going to talk to us about these differences. Like, what are some of the symptoms that we might see with allergies or contact dermatitis that are or maybe aren't associated with the mask? David, welcome.
Hi, how are you?
All right. So, hey, let's talk about it. So what's going on with the mask and being healthy and dealing with your skin? Is that a thing? Is that something that needs to be addressed?
So I mean, let me first start off by saying that I think it's very important that people should wear masks out when they're in close contact with people. I think it's good medical decision-making. We don't have a vaccine. We don't have anything else yet to protect us from the virus. And I think it really is the one thing that we can use to make ourselves less at risk of being sick, and obviously protecting people from us if we breathe out. We make sure patients wear masks in my office. So interestingly, I would say about once a week, I end up seeing some patients who get red around the mouth after wearing a mask because they're wearing it a lot, they're breathing in and out, and they get some small red rashing around their mouth. And it's not really irritation from the mask, but because of the wetness of the mask. If their skin is sensitive, they're an eczematous patient to begin with, so they have a skin issue to begin with, they're more prone to getting localized rashing from the masks.
Okay, my allergies have been crazy. And Big Al and Dr. Moshe know, during one of our pre-production meetings, I had to excuse myself because of how many times I kept sneezing during our Zoom meeting. And so I feel like my allergies are worse during this time. Have you seen an influx of people with allergies during this time, or is it the same around the same time?
So it's a good question. So, I mean, I'm in New York. We have much more definitive peaks than like most would have in California and other places in the country. So we have a usual peak in the first and second week of May where everyone's miserable because of oak and birch tree. I mean, it's like clockwork. It's like death and taxes. You just know that that's when people are going to be bad. So we want to make sure all the patients are taking their medications. When it first became apparent that this COVID was going to be a pandemic, people were nervous about using some of the allergy medicines like topical nasal steroids, thinking you might be more at risk of getting sicker. That is not proven at all to be the case. And we've encouraged all our patients to stay on their daily medications. And for somebody like yourself, much better than using oral antihistamines is using a nasal steroid like a Flonase, a Nasacort, a Rhinocort, which are over the counter. Takes a couple days for them to build up. And again, because you don't want to sneeze and your face is covered by wearing a mask, it's probably worthwhile to be on those medications if you have seasonal allergies. What's interesting is that people's indoor allergies have been a little bit worse, because they're around their animals more. They're in their dusty homes and environments. So outdoor, it's very variable. You have some patients say, I'm going out for a run every day now because I'm home. It's something to do. I certainly do the same thing. I take a run or a walk. I do my Zoom classes with my trainer outdoors 3 times a week. So I'm outdoors. And so it bothers me. But a lot of people have chosen not to go out much at all. So they don't have the same exposures necessarily. Indoor stuff worse for sure. Outdoor stuff, it really depends on how much these people are going outside.
So I have a friend who has asthma and she takes an inhaler.
Mm-hmm.
And you know if that would be a thing that really affects you during this time of the year, especially in springtime when everything is falling, things are blossoming. Is that a problem with the inhaler?
So the fact is, the same way with treating people's noses, we have people stay on their daily asthma medications. People who have allergic-based asthma seem to do better than people with non-allergic asthma or no asthma at all. However, we insist patients stay on the medicines. There is no risk at all from staying on your daily inhalers. The other thing is that oral steroids were a big controversy early on in the disease. So in the beginning, it was felt to propagate the virus and make things worse. And that might have been true in the first few days that you're sick. But we saw a lot of patients a week or 2 out who weren't hospitalized, who had asthma attacks because it's like a virus like anything else. And some of them need to be on oral steroids, and they all did fine. So it's really the timing of it. So topical medicines, absolutely you should stay on. And oral steroids, it's really the judgment of where you are in the course of COVID or have you been exposed, whether or not we would use them.
Okay, because when I had my allergies and my allergies were just going crazy, I was like, is this COVID? Do I have COVID because of my allergies? Is this a pre-COVID situation? What would you tell me if I was in your office, like, I have COVID, my allergies are so bad? Is that a thing?
So the most common symptom, sneezing is not a major complaint for people with COVID. It's fever. About 2/3 of people get fever, not everybody, but it's body aches, sore throat, extreme fatigue, loss of sense of smell. So I have patients who have chronic sinus issues who lose their sense of smell. And now some of them say, you know what, you think it's COVID? The sense of smell issue can be touchy, whether or not this is related to COVID or not. But as far as allergies, typical people with allergies, itchy, watery eyes, sneezing, nasal congestion, not the major complaints that people have with COVID. And you certainly would not get a fever or severe body aches that you would get with COVID that you would not get with allergies.
So is rescue inhalers in that same category as well?
Well, rescue inhalers will be safe no matter what. Now, nebulizers, interestingly, there was a run on rescue inhalers because when you have a nebulizer, it aerosolizes particles. So in the hospital setting, where normally patients who had a wheezing episode would necessarily use albuterol via nebulizer, they were not using them because it would aerosolize particles. So meter dose inhalers are the traditional puffers. Those should be fine and safe to use. Again, the nebulizer issues, I have not, again, used the nebulizer in my office since this started because I don't want to aerosolize product when people are coming in because you don't know who the next patient coming to the office is and what the patient I'm treating is.
And this is one of the last questions I promise we get asked a lot. Testing, because people keep hearing that word. Allergies versus sinusitis, getting tested. Are those patients or asthma at more risk? And so maybe they should get tested sooner than waiting, or what do you think?
Well, I mean, I think, testing has become a little bit more ubiquitous. So I think if you have a lot of the basic symptoms, if you have fever, body aches, you should get your nasal swab. Remember, about 1/3 of the patients who get nasal swabs will have false negatives. And that really stems from the fact they don't get far enough up the nose. So if I have a patient, when this all started, like we're a little ahead of you in New York, we're sort of at a nadir right now, and you're certainly, in the West peaking a little bit, and Texas as well. So the fact is, in the beginning, patients would come to me or call me on the phone and say, well, I can come into the office because I had a swab and it was negative. And when I hear the symptoms, a lot of times I would do a virtual visit because, patients just assume because the test was negative, they don't have the problem. So I guess to answer your question, it really is based on the symptoms, and you have to go on that clinically more than what any test shows. The antibody tests are a little better, but that's to show you had it 2 weeks earlier. And that's not really that useful when patients come in. As far as testing people for allergies or what have you, our office is, again, pretty much open as usual. I won't say that's across the board. We have a lot of set protocols about going to your doctor. You have to speak with your own doctor, but we have temperatures taken in the lobby before you come into our building. It's a medical building, so we have about 15 or 20 doctor's offices, and we have a representative from one of the offices every day downstairs taking temperatures. You get a phone call before you come in, so you're doubly checked why you're coming into the office, not just popping in. And then you go right into a room, so you're staying in your car until your appointment time. So you're not sitting in a waiting room, you're not seeing 1,000 people. So it has slowed the pace of the office somewhat, but we're pretty much practicing as usual in New York at the moment. We'll see what happens with any resurgence other places.
Okay.
Well, you're always a wealth of information. I hope we can call on you again. I can never get too many questions answered by you. Thanks so much, David, for doing this.
My pleasure. Thanks so much, guys.
Thank you so much.
You're very welcome. Nice seeing you all.
All right. Hey, look, we had a great show. This has been a lot of information you've taken in, but it's really good. First off, we learned about the airlines. They're safe. They're one of the safest places you can be right now is on the airplane. As long as everybody tries to stay safe, wearing a mask, and make sure you deal with your own faith if you want to just go for it and take a flight. That's the biggest thing that people are worried about, but they say it's safe. It's definitely safe. So the next thing is, man, dealing with the allergies and dealing with all kinds of stuff. Is that COVID? Is that the essence of making it? We talked to the doctor, and he says no, that's not it. And also, we're dealing with masks. Look, everyone has a mask or a face covering of some sort, but make sure it's at least 3 layers of protection, and maybe not necessarily have the respirator thing, the Darth Vader thing on the side of my mask. There might be more harm than good. And yes, my biggest takeaway, yes, you can have sex during the pandemic. It's not going to cause a spread of COVID-19. It may cause a spread of other things, but definitely not COVID-19. So, hey, thank you so much for tuning in and being a part and making us a part of your day.
Make sure to like and subscribe to our channel and keep the comments going. We would love to hear y'all's feedback. Thank you so much.
And again, keep asking questions. Thanks so much for joining us.